A report released today has important information for women and breast cancer survival.
Medical reporter Liz Bonis joins us now with more on that in today's Health Alert. Liz.
Good afternoon to both of you. This report takes a closer look at why some women diagnosed with breast cancer, even at a very early state, don't have the same survival rates as others. They specifically wanted to find out if ethnicity or racial background played a role.
So to find out more, breast cancer researchers who supplied this video through the Journal of the American Medical Association looked at the medical records of more than 450,000 women diagnosed with breast cancer. They looked at those who were diagnosed at a variety of stages and sizes and followed them for at least 7 years after diagnosis. They found compared to women who were white, a black woman was 1.5 times more likely to die of a small breast cancer. A Chinese or Japanese woman was about half as likely to die of a small breast cancer. And a Hispanic woman had very similar survival rates to that of a white woman.
Now, what does all this mean? Well, previous studies have noted that access to care might influence breast cancer survival in different races. But this study actually says that these women were diagnosed early enough that even with the same access to care, there are different outcomes. And that means there may be biological differences. For example, they found cancers are not more common in young black women, but those who get breast cancer at this stage or this age and who are this race are more likely to develop an aggressive type compared to, say, a Chinese woman or sometimes even a white woman. What that tells us is that, our genes are biologically different. And we know when a younger white woman, for example, gets breast cancer, we've learned to treat that aggressively. It may be a more aggressive cancer when it strikes early. We may need to find this out in each race and treat accordingly. And it just goes to show you that God made us just in a wonderful way, but we can't just necessarily assume that what's right for one is right for all.
Well, and you have to do specific research too. It reminds me of heart attacks with men and women.
Yep.
We react differently.
And not just men and women, but it's one of the reasons we need all ethnicities to participate in research trials, because otherwise you don't find out these differences. So, kudos to anybody who steps up and does that.
I hear you. What do you got coming up?
Coming up in our next half hour, Chick Fit. You're going to have to step into the other room. Sorry.
Okay.
That
But really
happens
cool
a lot
stuff.
with me. Liz, thanks very much.